Own your consult. I'm fortunate that when I consulted with healthcare professionals after my diagnosis, they all seemed to fall into one of two categories: competent and exceptional. And yet, I still felt uncomfortable asking certain questions about how treatment options would affect my training, because part of me felt like I was being ungrateful. So here they are saving my life, highly skilled professionals, and I'm over here like, okay, but could I take a punch with implant reconstruction? And what would it really take for those babies to rupture? Which, by the way, sounds like an amazing experiment for Mythbusters. Anyway, doctor appointments are usually pretty quick, and because I was diagnosed in 2020, a lot of them were virtual or even just over the phone. I had to go to the in-person ones alone, and so I had to learn how to self-advocate. Here's what I recommend. Number one, understand the basics. When you have breast cancer, you will almost certainly have surgery to remove the cancer. You may not need or want reconstructive surgery or surgery to improve symmetrical appearance, or you might opt for one of two categories of reconstruction: implant reconstruction or reconstruction using your own tissue. Number two, before your appointment, write down a quick explanation of the movements and impact in your martial arts or self-defense training. For example, if you do judo, you take throws where you land on your back, your side, forward, hopefully on your forearms, ideally. You grapple on the ground, you lean on your opponent, you get leaned on, you get choked. Just write this out and try to use terms non-martial artists will understand. You might want to save a couple of pictures to your device that illustrates the movement. And don't just rely on being able to go online to find these pictures. The Wi-Fi signal is not always very strong. Number three, write down ahead of time, or at least have in your mind, what are your deal breakers? To me, I didn't want my muscles to be compromised at all. It took me long enough to be able to do one push-up, damn it. I was not going to let a surgery limit my movement or strength. So your deal breakers might be completely different, and that's totally fine. But it's a good idea to know what they are in advance, because that will help your surgeon or treatment team eliminate certain options. So you go to your appointment and you have your pictures and you have your descriptions. You may see different types of providers, like surgeons, radiation oncologists, medical oncologists, so be aware you might need to save some of your questions for other appointments. For example, a surgical oncologist might defer to a plastic surgeon for a lot of your martial arts questions. One thing to anticipate, though, is that your need for information might not necessarily fit in with the normal flow of the appointment. Think about their average patient. So 4, be upfront about it when you meet with the nurse and when the doctor comes in right away. You can say something like, my martial arts training is extremely important to me, and today I really need to discuss with you how my treatment will impact my athletic performance. I have some pictures and some descriptions, and then you can pull that out. Remind them halfway through the appointment if they haven't addressed it already. It may feel rude, but it's not. It may even save them time in the long run. Number 5, you may need to push to get answers. Be aware that medical professionals may communicate in terms of best case scenarios. And if the professional is kind of glossing over your concerns or not being direct about answering your questions, it's okay to probe deeper, because them not addressing your questions doesn't necessarily mean that you will get the outcome that you hope for. So you could ask questions like, if everything goes well with surgery, how will my training be impacted? What do you imagine a training session will look like for me? Will I need to take any precautions, and what would those look like? And if everything doesn't go well with surgery, if there are complications, how would that impact my training? What would that look like in terms of the actual training session? It's got to be a little odd for them, because they're probably not thinking about patients walking through the door obsessed with their fight club. So you might just need to reorient them a little bit. So a recap. Number 1, understand the basics, so you're aware of the options that may be presented. Number 2, before your appointment, write down the movements and the impact in your martial arts training. Number 3, know your deal breakers. Number 4, let them know at the beginning of your appointment and then halfway through about the questions that you need addressed. Number 5, push to get answers if you feel your questions aren't being addressed. Remember, most of the time you can get a second opinion. I ended up consulting with 2 different surgical oncologists within the same hospital system and 3 medical oncologists from different hospital systems. and I'm really glad I did. In the next video, we'll talk about recovery so you can get back to training as soon as you're cleared to. And yes, please wait until you're medically cleared.